البدر علينا من ثنيات الوداع وجب الشكر علينا ما دعا لله داع.
Assalamu alaikum, my dear community. My name is Masma Huda and I am a member of the Health Committee of Wessex Jamaat. I'm sure you've all heard of COVID-19 by now, a virus that has become a pandemic. In this video, we as a community want you to know what you can do to stop the spread of the virus and for you guys to keep safe. When a person who is infected by COVID-19 coughs or sneezes, they can spray droplets as far as 6 feet away. If this is breathed in, the virus can then get into your body. It is also spread by touching a surface or object the virus is on, then touching your mouth, nose, or eyes. Some people who have the virus may not have the symptoms, however, they can still spread the virus. The most common symptoms are a recent onset of a new continuous cough, a high temperature, and or shortness of breath. There are 3 categories of guidance from the government. The first category is shielding. This guidance is for the most vulnerable who are at a very high risk of severe illness from coronavirus because of an underlying health condition, such as those who have received organ transplants or who are receiving active cancer treatments or people with severe respiratory conditions. You would have been contacted by the government to stay at home at all times to avoid any face-to-face contact for 12 weeks. The second category is social distancing. Now, this applies to absolutely everyone. Since the announcement Boris Johnson made on Monday, March 23rd, it is important that we only go outside to shop for the basic necessities such as food, medication, or any medical needs, such as providing care to help a vulnerable person or traveling for work purposes, but only if you cannot work from home, and also for one form of exercise a day. This can be done either alone or with a member of your household. If you do need to go out, it is also important that you stay 2 meters apart from other people. The third category is self-isolation. If you have the symptoms mentioned earlier, no matter how mild, please stay at home and do not leave your home for 7 days from when your symptoms first started. If you do live with someone who has the symptoms, then please do not leave the house for 14 days, as it is possible you too have caught the virus and it can take a few days for your symptoms to present. If your symptoms worsen after 7 days, contact NHS 111 online. And if you do not have access to the internet, then please call NHS 111. These measures have been taken to reduce social interaction between people. It is really important that we all do this so we can work together as a community to prevent the virus from spreading. I know it's a difficult time for our community as we regularly visit our close relatives and friends. However, I must stress the importance of avoiding visiting those outside of your household. But don't worry, remote technology is great to stay in touch and check up on one another, and we can now easily video chat our loved ones with the click of a button. During these times, it's also important that we minimize spreading the infection through good hygiene. Therefore, it's really important we all take on board the following advice. Firstly, hand washing, and hand washing. I cannot stress the importance enough of washing your hands for at least 20 seconds using soap and hot water, especially if you have just coughed, sneezed, or blown your nose, or have been in a public area where other people are doing so. This is also important when you've gone shopping or if you've picked up any post that has come through your door. If you're coming into contact with anything from outside, then please make sure you wash your hands after. Use hand sanitizer if that's all you have access to, and then wash your hands as soon as possible. Secondly, it is essential that when you cough or sneeze, please cover your mouth and nose with a tissue or your sleeve if you do not have tissue available to prevent the spread of germs. Please do not use your hands. Please then dispose the tissue in the bin immediately, followed by washing of your hands or the use of an alcohol-based hand sanitizing gel. Thirdly, it is also important to clean and disinfect regularly touched objects and surfaces to reduce the risk of passing the infection onto other people. This includes things like your mobile phones, credit, debit cards. Fourthly, remember to wash all fruit and vegetable that you have either bought from the shops or have had delivered to your home, as the virus can still stay on surfaces. This also includes packaging on food items where the virus can stay on the surface for 6 to 9 days. So be sure to wash everything thoroughly before eating. These are challenging times for everyone, but inshallah, these measures will help to ensure everyone's safety. Don't see social distancing or self-isolation as all doom and gloom. You can use this time for reflection, learning a new skill, or connecting with someone you haven't spoken to in a while. Try and make sure you get your daily exercise in, as the benefits of exercises are both physical and mental. There are lots of exercises we can do from home using videos on YouTube. One example is Joe Hicks' daily live exercise videos, which show on YouTube at 9 a.m. Monday to Friday, which the whole family can do. All of the up-to-date information can be found on www.gov.uk/coronavirus. And if you do have any questions, please email us on health@almahdi.org.uk and we'll try our best to answer them. Stay safe and healthy, and please remember, Allah does not burden a soul beyond that it can bear. We can get through this as a community, inshallah. Thank you.
وجب الشكر علينا مدى